Cardioversion. For this skill, you will need an ECG monitor defibrillator machine, defibrillator pads, and PPE. Monitor or defibrillator operation may vary depending upon the manufacturer. Be sure to carefully review and follow all manufacturer recommendations before operating any monitor or defibrillator. Don gloves and other PPE as needed based on local protocols and the patient's situation. Initiate any appropriate BLS and ALS procedures. Then place the limb electrodes on the patient and turn the monitor on. Determine the need for synchronized cardioversion. Select the lead that shows the tallest upright QRS complex.
Sir, your heart's beating a little too fast.
Explain the procedure to the patient, and if after asking about allergies the patient's condition permits, administer an analgesic or sedative. Place the defibrillation pads or paddles on the patient's chest. Select anterior-anterior or anterior-posterior placement. Ensure the paddles or electrodes do not touch. If paddles are used, ensure the gel pads or an appropriate conductive media is applied to decrease resistance before the paddles are applied. Then make sure the patient has a pulse and that the rhythm and patient condition indicate cardioversion is needed. Turn on the defibrillator and activate the synchronize mode on the monitor defibrillator. Check to see that the QRS complexes are being recognized by the monitor. Charge the defibrillator to the appropriate energy level. This will vary according to the type of defibrillation waveform, monophasic or biphasic, that is programmed into the defibrillator, the ECG rhythm, and local medical director's protocols.
Sir, you feel a jolt in your chest.
Prepare the patient for an uncomfortable jolt.
I'm clear,
Proceed by stating, I'm clear, you're clear, everyone is clear, as you look from head to toe to be sure no one is touching the patient. Then depress the shock button or buttons. Wait until the energy discharges. This may take a moment or two because the machine will wait to fire on the appropriate phase of the cardiac cycle. Assess the rhythm for any change. Reassess the patient's vital signs to see if additional cardioversion or treatment is needed. If the rhythm hasn't changed and cardioversion is still indicated, repeat the cardioversion at the next appropriate energy level. Remember to reselect the synchronized cardioversion button.
Sir, you're going to feel a jolt in your chest again. Sir, your heart's beating a little too fast. You need to do something to slow it down. What we're going to do is give you some medication to make you feel a little drowsy, and then we're going to have to give you what we call cardioversion, which is electricity to help slow your heart down. But with the medication, you shouldn't feel a thing.
Correct.
And are you allergic to any medicine?
Sulfa.
Sulfa drugs?
Yes.
Okay. Sir, you're going to feel a jolt in your chest. I'm clear, you're clear, everyone's clear. Shocking.
Boom.
Sir, you're going to feel a jolt in your chest again.